So my session focused on genetic skin disorders. And so the first section was really thinking through who would even be screened for genetic skin disorder. And we talked a lot about putting the skin in context of the child, that the child development is so critical. So looking at their physical growth, things like head circumference, but also looking at their development, and talked about how you would find developmental milestones. You can find that on the CDC website. And if a child is having developmental delay and has skin findings, that might increase our likelihood of referring them to genetics for evaluation. The rest of the lecture focused on more specific genetic syndromes, and we kind of broke it down into those that have hyperpigmented birthmarks, those that have hypopigmented lesions, those that have keratinocytic lesions, and then those that are at risk for internal malignancies, because you want to catch people early that might have a cancer risk and get them into surveillance. So this session focused on complex medical dermatology in children. And so we looked at a number of conditions, including infections such as herpes, simplex virus infections, and other cutaneous infections. But I also had a large chunk on reactive infectious mucocutaneous eruption. That's a mouthful, which we call RIME. So RIME is a condition that occurs primarily in children, but can occur in adults, where people develop a reactive mucositis of multiple sites. So the eyes, the mouth, or the genitals, in the setting of a recent infection. And it's quite morbid. People can be hospitalized, children can be hospitalized for several weeks at a time. So we want to kind of really focus on early recognition and understanding what to get these kids into care, with hopes that we can kind of abort the process and not have it lead to so much morbidity. So as pediatric dermatologists, we're always excited when we get new medications, especially with younger ages of indication, because they tend to trickle down to us after the adults. So one such kind of arena would be the approval of more non-steroid topicals for the treatment of atopic dermatitis. That's very exciting because there may come a time with our more moderate children. Severe, I think we'll be thinking about systemic agents, but our moderate children, where we may be able to use sort of like a kitchen sink of different non-steroid topicals and be able to manage them more effectively and not need to escalate to a systemic agent. That being said, I'm excited about the systemic agents that are coming down to younger and younger ages and newer indications, because that's going to give us workhorse medications to use for children who have serious inflammatory skin diseases. So that is really where we're looking, the approval of new medications and new indications at younger ages. At Children's National Hospital, we're really privileged, being a standalone children's hospital, to be a referral center for an entire multi-state area. And I'm really excited about my faculty and the development of our many research areas of focus, in particular with Dr. Costello-Socio developing a hair disorder program with many clinical trials in alopecia areata, and also genetic skin diseases coming down the pipeline. And same with Dr. Cotton, who's working on hidradenitis suppurativa, and also developing clinical trials in that arena. So we're really hoping to be the destination for clinical trials in children in the Mid-Atlantic area, and that's a real focus for us. For me personally, I'm the fellowship director for our Pediatric Dermatology Fellowship, and we know we have a huge workforce issue in Peds Derm, and so I'm thrilled that we actually got a second Peds Derm Fellowship position approved, and hoping, fingers crossed, that we will match 2 fellows for next year. That's coming up in the next few weeks. And so that'll be a huge change for us to go from no fellows 3 years ago to 1 fellow for the last 3 years and then 2 next year, to kind of bring that workforce in, to have more pediatric dermatologists, hopefully keep some on faculty, and educate the next generation.